Morning, everyone. Um, Going to run through a number of studies that have been published here in the last couple of weeks, just as kind of a compendium of recent science, and it's not necessarily united by any single theme, although there's a couple of themes that run through this. And so the first study I think that's interesting to look at is a study that came out less than 2 weeks ago, looking at neutralizing antibody titers from serum of people who were infected with BA1 in South Africa. So it's a relatively small study, as you see there, 24 unvaccinated and 15 vaccinated persons, but I think it shows some interesting immune escape phenomenon that the folks have been talking about. So first of all, if you look at the figure on the left, those are people who were unvaccinated and infected with BA1. And what you see is, not surprisingly, they have relatively high neutralizing antibody titers against BA1. And then the neutralizing antibody titers drop off when you mix those serum with BA4 and BA5 viruses. And you can see the fold reduction is about 7.5. So that means that the serum of people who were infected with BA1, who had not been vaccinated, was about 7.5 times less effective neutralizing BA5. And that is one of the things that's driving the BA5 wave here. Is infection with BA1 doesn't necessarily give you great protection against BA5, with the caveats that we've talked about, as neutralizing antibody titers are not perfect correlates of immunity, but they do suggest how much immune crossover you're going to get. Now, the second figure on the right is people who were infected with BA1, but who also had been fully vaccinated before that, or at least had had the initial series of vaccine. And what you can see is those people have a much less pronounced drop-off between BA1 and BA5, only about 2.5 to 3 times, 2.5 for BA5, which means vaccination gives you significant advantage in your immunity from BA5 if you'd been infected with BA1. Now, you can also see there's an even bigger drop-off against, when you compare it to neutralizing antibody titers against D614G, and that's the original virus. Essentially, that's the Wuhan clade virus. And so you can see that the difference between BA1 and D614G is pretty small, right? So that makes sense. If you've been infected with BA1 and you'd been vaccinated, you'd expect you had pretty good immunity against both BA1 and the original virus. But you can see your immunity against BA5 is still pretty significantly reduced, tenfold lower than against the original virus. And again, that makes sense, and we know that the drift away from the original viruses has led to lower immunity against new variants. Now, what's a little bit interesting is if you look in people who had not been infected by BA1 but were only vaccinated, you see that there's not much of a difference between BA1 and BA5, and the difference in neutralizing antibodies with BA1, 4, and 5 compared to the original virus are all about the same. And so, and a little bit more, as you can see, than about twice another reduction of neutralizing ability compared to folks who've been vaccinated and infected. And so a couple of things to take away from this study that, hopefully this is highlighted. The vaccine gives you significant advantage, especially when you combine that with prior infection. And so your neutralizing antibody titers are boosted quite a bit when you have vaccine and prior infection. And these new variants of BA4, BA5 have drifted significantly from the original virus, D614G, and BA1, so that your immunity with these new variants based on prior infection or prior vaccination has gone down considerably compared to earlier variants. The second study I wanted to talk about was a study that came out just in the last week or so from Canada that looked at vaccine effectiveness in kids. So again, we haven't had a lot of big studies that have been able to look at vaccine effectiveness in young kids. This was in age 5 to 11. Especially looking at real world data of vaccine effectiveness against severe infection and hospitalization. So this is one of the first studies that gives us an insight into that. And this is roughly 13,000 children in Ontario who presented with COVID-like illness. As you can see, 8,600 tested COVID positive, 4,300 were COVID negative, and they did a test negative comparison study to look at vaccine effectiveness. You can see among those are 115 hospitalizations and 5 deaths. So, a fair number of severe outcomes to allow them to compare. What they saw as vaccine effectiveness, as you would suspect, with symptomatic infection was good, but not great. And you can see that after the second dose, that vaccine effectiveness against infection had gone down to about 35%. Again, not horrible, but not great, and decreasing over time. But vaccine effectiveness against severe outcome, hospitalization and death was still quite high, 74% at 60 days after the second dose. Now, if you follow that trend line that I drew with a dotted line, you can see that if it remains in that linear downtrend, eventually you'll get below 50%, probably at around 6 months, just with a rough swag. So as expected, this study shows that in kids, vaccine effectiveness after 2 doses is quite good, especially relative to severe outcomes. But that seems to wane over time. And after 6 months or so, the vaccine effectiveness is probably going to drop below 50%, which was kind of our original target that the WHO and FDA had set out. And that's pretty similar to what we've seen in older adults, right? Vaccine effectiveness, very good, especially against severe outcomes. But after 6 months, it starts to go down. And this is just, I think, an indication that kids are also going to need boosters, and that's not necessarily surprising. What's also interesting is when they looked at the spacing between the first and second doses, that reaffirms what other studies have shown, that you get better immune response if you space out those first 2 doses over a longer period of time. And you can see if you spaced it out over greater than 56 days, that gave you even better immune response, at least in terms of vaccine effectiveness compared to lower space dosing. And you can see on the right that meant that you had pretty consistent vaccine effectiveness over the first 2 months, and then or 3 months, and then greater than 3 months, your vaccine effectiveness started to go down. But what this means is if all of those kids had been spaced at least 55 days or more, potentially we would have seen a little less decline than what we saw in that vaccine effectiveness trend in the previous slide. But kind of confirms, I think, what most of us suspected. Vaccines work well in kids. The effect will wane over time and we'll need boosters. And those spacing those first 2 doses is probably better. Now, this was an interesting study that was published in Pediatric Research, which is a small study and certainly not definitive, but suggestive and suggestive of, I think, a concerning phenomenon. And that's the fact that in this study, at least in this small group of newborns that they looked at, 14 newborns appeared to be able to be infected in utero before birth, and still were shedding virus and therefore were actively infected, remote from their mother's infection during pregnancy, but with unknown clinical significance necessarily. And so a little bit complicated, but you see this graph here on the right in panel C. Those bar graphs are essentially the timeline of the pregnancy, and the little sunburst there is when the mother was infected, and then the diamond is delivery, and those test results there are hard to see. So I put the positives of those mothers who were positive at delivery, and you can see that most mothers were infected earlier in pregnancy, or at least maybe halfway or before. Most tested negative at delivery, so and all were asymptomatic save one, I think. So three of them. So essentially, these were remote infections during pregnancy, but you see many of these neonates were still actively infected after birth. And interestingly, not detected by nasal PCR, but detected in stool. So again, we know that coronaviruses are GI pathogens as well. We know that in some patients, we're able to detect it more readily in stool than we are in upper respiratory samples, and that's probably one reason why we're underdiagnosing a number of infections that end up in hospitalized patients. And this seems to be especially true in kids. Now, this is, I think, confirmed by the fact that you have heightened inflammatory markers, or at least hyper-inflammatory things in the stool that then elicit mouse macrophages to release various pro-inflammatory cytokines. And so this indicates that that presence of virus in the stool is associated with an inflammatory response in the neonate. And we don't know clinically what significance that bears, but it does certainly raise the possibility that these kids will have potentially long-standing health consequences related to this. We know that your set point at birth in terms of your microbiome, your gut microbiome, and your gut immune response actually has a profound impact on your growth and development and health later in life. And so this is essentially just a teaser study, but I think one that, again, raises a concern and also points out that there's a lot about this virus and COVID that we don't know. And we assume a lot when we assume that some of these consequences of infection are not going to raise is not going to be something that is associated with long-term health consequences. Speaking of long-term health consequences, a number of studies that looked at long COVID that came out recently that I think are interesting. This first was published in CID, looked at long COVID. You can see a large number of patients, over 200, followed for 12 months, and then fewer of those who were able to be captured at 18-month follow-up, and then with roughly a similar number of age-matched controls. And these were infections early on, as you can see, essentially between February and April of 2020, and then looked at how they fared over the next 18 months in terms of long COVID symptoms. And what you can see is a dramatically higher risk or odds of things like fatigue, memory problems, impaired concentration, and shortness of breath in all of the participants at 1 year. So significant findings at 1 year after infection, indicating a number of these folks had long COVID that was at least lasting a year, obviously. Now, what's also interesting is that this was more profound difference in terms of memory problems and impaired concentration in younger people under the age of 30. So you can see in folks between the ages of 16 and 30. Now, again, relatively small numbers, so take that with a grain of salt, but that trend is consistent. And you can see also in 31 to 45-year-olds, pretty high odds ratio of impaired concentration, folks who had COVID versus folks who didn't. And then when you extend it out to 18 months, you can see still a very significant excess risk of fatigue, concentration problems, memory problems, and shortness of breath in folks who had COVID versus those who didn't. So again, more evidence piling up that long COVID indeed is long and can be relatively common. Second study that looked at 2-year findings in people who had been infected with COVID. And this was, as you can see, a cohort study of over 1.2 million people. And this looked specifically at neurological and psychiatric abnormalities. And you can see this followed over a cohort of 89 million patients between multiple countries. And then 1.3 million that were matched for COVID infection versus those who did not have COVID infection, or actually were infected with another respiratory virus. And so what you see here is a significant association with all of these findings except encephalitis and Parkinsonism. The p-values for all of these other elevated hazard ratios is less than 0.05. And what's especially profound is the difference in dementia and myoneural junction or muscle disease. And then looking at different age groups in children, and this was 185,000 kids, so a pretty large group that was compared. A very significant difference in incidence of epilepsy and seizures in kids at a 2 years who had previous COVID infection, and also a significant increase in psychotic disorder and that myoneural junction or muscle disease. What you can see in older adults is that cognitive deficit, dementia, and psychotic disorder had dramatically higher rates in COVID versus those without COVID, and that p-value of less than 0.001 is highly statistically significant. So again, showing that even over a long period of time of 2 years, significant neurological and psychiatric sequelae in people with long COVID in a very, very large study. Now, they also looked at the idea of a time horizon, and that time horizon you can see with the dotted line, which is equal to a hazard ratio of 1. So that means that the odds or risk of having this disorder is the same in people who had COVID and people who didn't. And on that top line, you can see that for things like ischemic stroke, some of them revert back to kind of that time horizon within the first 6 months or so. So early on after COVID, your risk of having an ischemic stroke is quite higher than people who didn't have COVID, but that risk kind of goes back to equilibrium by about 6 months. So after 6 months, your risk of ischemic stroke is about the same if you had COVID or if you didn't. But what's interesting is if you look at things like dementia, epilepsy, and psychotic disorder, that did not approach that event horizon or hazard ratio of 1 over the course of 2 years. And so this indicates that these risks may be elevated for a very long period of time, many years, or potentially even the rest of one's life. So dementia, epilepsy, psychotic disorder, again, they don't look like they're getting any closer to 1. In fact, if anything, they're getting a little greater. And so this means that these may be very long-term consequences of COVID in a significant proportion of people. The third study here to look at long COVID is a study out of the Netherlands that looked at 167,000 people. Again, obviously the Netherlands is not a terribly ethnically diverse population, so take that with a grain of salt. This is obviously biased towards white Northern European ethnicity. However, it is, I think, a good contained cohort with very good health data that allows us to get very good insight into long COVID trends. And you can see these were folks followed between March of 2020 and August 2021, so about 18 months, with a series of 24 consecutive surveys that had relatively good response rates. You can see here about over 4,000 participants, and a relatively small proportion of those actually had been hospitalized with COVID. Those were 4,000 participants with COVID. But most were, mild or moderate disease that did not require hospitalization. And again, what you can see is over the course of about 18 months, over 40% of COVID patients had some symptoms of at least moderate severity compared to under 30% of those without COVID. And again, increase in symptoms, almost 30% in patients with COVID and about 18% in patients without COVID. And again, what you see is these differences seem to be persisting and consistent over time. So I've blown these up over here on the right. You can see that loss of taste and smell seems to remain in a large proportion of folks, even out to about 8 months. And that's the same with difficulty breathing and general fatigue. So a significant difference between people with COVID versus people who did not experience COVID. And again, that seems to persist over a long period of time. So that's it for those studies. And I think the bottom line is, again, vaccines work. They add additional protection if you've been infected previously. And we know that the vaccines are starting to work less well with newer variants that have heightened immune escape. The vaccines work in kids. Long COVID is present in a significant proportion of people. It causes significant disease, and it is indeed long. It's lasting now 18 months to 2 years in some folks. So more data to support continuing efforts to mitigate transmission within the community. Thanks.